All right, if we want to go ahead and get started, we can go ahead.
Okay, great. Good evening. I am Deborah Gilbert White, co-chair of the Delaware Continuum of Care Advocacy and Policy Committee. The Delaware Continuum of Care is a group of community members, service providers, leaders, advocates, and concerned citizens working together to develop solutions to homelessness. It is a community-based collaborative that ensures a responsive, fair, and just approach to addressing homelessness and strives to achieve housing for all. Before COVID-19, housing and homelessness were critical issues as many encountered the lack of low-income, affordable, safe, and secure housing, and others lost housing for various reasons. COVID-19 informs us that we cannot be about business as usual when more people are living with housing insecurity. We are pleased for this opportunity to have candidates and constituents engage in this important conversation. I welcome you on behalf of the Delaware Continuum of Care, the Housing Alliance of Delaware, and all Delawareans experiencing and at risk of homelessness to our first virtual Candidates Forum. Welcome.
Thank you, Deborah. My name is Tony Cerzega. I'm an attorney with Community Legal Aid Society, and I serve as the co-chair of the Continuum of Care's Advocacy and Policy Committee. It's my pleasure tonight to introduce our moderator, Mark Eichman. Mark has been covering news in Delaware for nearly 20 years. In addition to writing about Delaware for WHYY.org, Mark is the deputy managing editor of WHYY's Delaware desk in downtown Wilmington. Since starting at WHYY in 2008, he's produced hundreds of stories for radio, TV, and the web. Mark has hosted and co-produced 2 half-hour documentary programs on crime and education in Wilmington, which were both awarded regional Emmy Awards this year. Mark, we appreciate your career in journalism dedicated to covering Delawareans, and we thank you for serving as our moderator tonight.
Tony, thanks so much, and thanks to everybody at the Delaware Continuum of Care for putting this on. Just a really important conversation, I think, about solving issues of housing and homelessness, and just such an important topic that so many times gets really buried in these, in the political conversation because of a number of reasons. But engaging community conversations like this is something we really value at WHYY, so I'm really glad to take part tonight in what as Deborah said, will really be a conversation among candidates tonight. It's not going to be really a strict, you have 2 minutes, you have 2 minutes, you have 2 minutes, and everybody gets kind of equal time. We're just going to kind of have a conversation with the candidates as they jump in. And it is a really nonpartisan conversation. All the candidates running for statewide office and General Assembly races were all invited from all parties. And I think we had as many as 16, maybe even more now, candidates taking part. So here's how it's going to work. We'll start with several questions from folks with lived experience in this area, and they'll share a little of their story, and they'll ask a question. And then candidates will virtually raise your hand with the little Zoom buttons to raise your hand and let us know that you want to chime in and answer that question or speak to that issue. And then I'll call on folks who have raised their hand in kind of an order, and then we'll have your mics unmuted. Candidates will have 2 minutes to answer the questions, and then we'll be monitoring time, and you'll hear a 30-second warning. And then if you go over, there's the power to take control of the microphone back with the mute button. So let's all respect each other's time. And then after our lived experience, folks ask their questions. If there's time, we'll offer more questions. And if any of the voters watching tonight have questions, we'll have people monitoring the chat too. And if we have time, we'll be able to get to them. So looking forward to a really good night, a really good conversation. Thanks to all the candidates for taking part, and thanks to you, the voters, for taking part and really being invested in this issue tonight too. So let's get started, and let's go to our first lived experience question. It comes from Sherman Holloway on the subject of family homelessness, and it's a topic Sherman, a single father with 2 children, knows about well. Families experiencing homelessness are often met with challenges to finding emergency shelter and housing due to the makeup of their family size. And generally less resources exist for families without housing, which adds to those daily pressures that keeping a family together without permanent housing. And according to Family Promise of Northern Newcastle County, statistics show that 40% of people experiencing homelessness in Delaware are families. So a really important topic. Sherman, thanks so much for being here. Thanks for your time tonight. Please go ahead with your question.
I'm sorry.
There you go.
I didn't know. I think my question is what can we do to stop homelessness? The mental health of it. Mental health. I think I struggled with that when I was homeless, trying to get my mind together, because you know, when you trying to get a house or you try to get money, you know, you have to have the mental capacity to keep it. So, you know what I mean? My question is, how do we help homeless people with mental health?
And so the first hand I see is Jordan Alley. He's running for the House District 4 seat. He's a Republican. Jordan, you'll be up first.
Thank you so much. And Mr. Holloway, thank you for asking the question and for joining. And thank you all for having me here tonight. I think what you state is this is not even just for folks experiencing homelessness right now, but really we have a serious mental health issue occurring throughout the state and throughout our country right now. I think one thing to address the concern of the mental health aspect, really, one of my biggest pushes and what part of my platform is our healthcare system needs a drastic overhaul. I think that's clear from the gate. People that have pre-existing conditions and trying to get insurance and quality healthcare are finding those struggles. And we all see the pain if you have health insurance, that there's high premiums and you just can't get the coverage you need. So I think one aspect is we need a healthcare system that is really going to push for preventative treatment, for assistance with mental health disorders and understanding that, look, even in our schools where there's so many kids that are experiencing, questioning what's going on in their life. And there's so much in our environment and in our day-to-day that's so divisive, and you need somebody that you can talk to. And if you have a great structure, that's great. But if you're, experiencing, like I came from, my mom was working hard, her and my dad, when they separated, they, I personally, yes, I didn't experience homelessness, but I felt loneliness sometimes. And that loneliness, I understand that having somebody to talk to, resource in your schools is vital. So I think in terms of addressing the quality healthcare, we need preventative treatment. We need counselors and guidance in schools to help students that are experiencing this. And really, we also need to focus on boosting our education system and ensuring that our students are being prepared for 21st century jobs, and we're bringing those jobs to Delaware so folks don't have to find quality jobs.
All right, thanks, Jordan. Next up is Lieutenant Governor Bethany Hall Long. She's a Democrat running for re-election. Lieutenant Governor.
Yeah, Sherman, thank you so much for that question. As a nurse who have spent 3 decades of my life working in policy and public health just because of persons struggling with mental health and homelessness, my husband is a veteran, got me involved early on. And what we continue to do is make sure here in Delaware, you'll hear from many candidates, talk about the issues. One, with mental health, 1 in 4 persons has a mental health diagnosis, and we've got to break down the stigma, number one. And when you are homeless, we have to make sure while you're here tonight that people have a roof over their head and food at the table. And so myself, and I know with other candidates who are here tonight who are really committed to make sure that we have the infrastructure. So for the past several years when I was in the state House and Senate later, have sat at housing committees, sponsored lots of legislation, the Homeless Bill of Rights and programs called SRAP, such that families as your own can have that equal, equitable opportunity that can get a house without the big down payment. So you have the financial assistance. But to get to the mental health side, I want your listening audience to hear this. We have now free services to anyone despite your insurance called bridge clinics in our state. You can call 211. COVID has shed a really bright light. Over the past 7 months, I've been on the street screening not only COVID, but persons struggling like yourself. And it is okay.
30 seconds.
And so what I would recommend is for you to know, sir, that there is help. Pick up the phone. If you don't have a cell phone, when you're at a shelter, talk to persons, say you are ready to get treatment. We can get it for free and have services for your family. And so a lot of conversation, but please pick up and dial 211 and or reach out to any of us this evening, my office and others. We will get you help. And for families, Delaware's small, we're mighty, and we have programs.
Thank you, Lieutenant Governor. Next up is Marie Pinckney. She's running for the Senate District 13 seat. She's a Democrat. Marie, you have 2 minutes.
Thank you, Mark. Hi, Sherman. Thank you so much for your question tonight. I think it's a really good one. It's a really important one too, because a lot of times we forget that when people are struggling with issues like housing, that like you said, there is a huge mental health component that even once families are in housing, the mental health component continues to exist. So I think that was a really, really important topic that you brought up. And I think that one of the big ways that we focus on it is through programs like the Bridge program that Lieutenant Governor Bethany Hall mentioned. I think that we make sure that we are maintaining and strengthening programs like that, and that once we get families into housing, that we continue to follow along with them. I'm a social worker and I do a program called case management. And case management basically says that I'm going to work with you around all of the issues that you have, and I'm going to continue to connect you to services through my case management that I continue to help you to be successful. So we're not just going to put you in housing, but we're going to make sure that you have access to trauma-informed care, that the children that are involved in the homelessness have access to trauma-informed care, that we make sure that we recognize that Black men struggling with homelessness have a specific lens of experience to mental health that other minority groups may not have, that we're speaking to people with Hispanic backgrounds, that we're speaking to people with disabilities, and that we're not just blanketing people under one specific lens, that we recognize that cultural competence plays a huge part in it as well. And I think another really important part is to make sure that people have access to healthcare. So it's not just enough to say that you need, it's not just enough to say that you need mental health treatment, but we make sure that you have access to the healthcare that's going to provide you the access to that mental health treatment as well. So thank you for a really, really important first question. I think that was a great one right out of the gate.
Marie, thanks so much. The next up is Eric Morrison. He's running as a Democrat for the House District 27th seat. Eric, you have 2 minutes.
Thank you. And thank you everybody for having me tonight. And thank you for that great question. And I'll say a few things. I worked in health insurance for 13 years, particularly in Medicaid and Medicare. So I saw firsthand the importance of mental health. Mental health is health. It is it's not separate from it. I know that in my family and myself have struggled with mental health issues, including depression and anxiety. I'm no stranger to those. So I cannot imagine compounding that problem with being homeless. I am adamant that healthcare is a human right. I am also adamant that at a federal level, and I know I'm running for a state level office, but we do need a program like Medicare for All that ensures comprehensive health care to everyone, regardless of whether or not you have a home, and that includes mental health services. I think too that at the state level, we need to explore options like Medicaid buy-in. We need to get a lot of special interests out of the way so that we can really focus on people's health and not profit and other issues. We need to make sure that we have counselors at shelters and in other places right there on the scene and physically and also with resources. So I think that's another important piece of this.
Thanks, Eric. Next up, we'll go to Sarah McBride. But before we do that, I just want to remind, we've had some candidates just join in to the forum. So if you want to weigh in or you want to answer a question or comment on a topic, just to hit the little hand raise button on the bottom of your screen, or you can just physically raise your hand and I'll keep an eye out for you. Next up is Sarah McBride. She's a Democrat running for Senate District 1. Sarah, you have 2 minutes.
Well, thank you so much, Mark, and thank you so much to the Delaware Continuum of Care for bringing us together. And Mr. Holloway, thank you so much for your question, for sharing your experiences. And I think a number of the speakers really highlighted a number of important issues. I think Jordan is absolutely right that the mental health challenges that folks face don't show up overnight. We need to make sure that young people have access to mental health services, particularly in our schools, by funding more school counselors. And I think the Lieutenant Governor really hit the nail on the head around combating and addressing the stigma around mental health and making sure that people feel more comfortable and safe accessing that kind of care. And I think one of the challenges that folks face who are struggling with housing insecurity and struggling with mental health is that they're dealing with coexisting stigmas around both housing insecurity and mental health. And in addition to addressing the stigma of mental health, we need to make sure that we address the stigma around housing insecurity, which only compounds and worsens the mental health challenges that people face. And I think we start by doing that. We start doing that by removing the criminalization of poverty and removing the criminalization of homelessness. And we begin to treat this and treat people who are struggling with housing insecurity with the dignity that they deserve and provide the support that they deserve. But it's a lot harder to come forward and get the care you need if society is repeatedly sending the message that to deal with housing insecurity and homelessness makes you a criminal and makes you less than.
Sarah, thanks. Then the last candidate that I see that has their hand raised to talk on this topic is Debbie Harrington, who's running for the House District 9 seat as a Democrat.
Mark, I believe James also raised his hand physically.
Okay. All right, Debbie, you have 2 minutes, then we'll go to James.
Okay, well, I won't take 2 minutes because we have talked quite a bit about this topic, but Sherman, really thank you for your openness with your question. It actually brought me back to growing up as a kid, and not that my immediate family experienced homelessness, but we always had someone in our household because they were homeless for different reasons. You know, maybe it was jobs, maybe it was domestic abuse. You know, there were so different things, but my mother was such a great caregiver, and she was always bringing somebody else in the house. And, you know, I'm one of 9 children. And so you can imagine how that house was quickly filled. But I think everybody has said, Sherman, the things that I was going to point out. And one, of course, is the stigmatism with being homeless, that we really do have to change that, so that those who are homeless don't feel the pressure of that stigmatism, and which helps drive that mental health situation, the mental health circumstances. And then, of course, you know, what's really around homelessness, a huge thing around homelessness is jobs. And so we those of us who are running for the different
30
offices,
seconds.
we have to be about creating jobs for everyone, and making sure that people have access to those jobs. But again, one thing that I've been pushing, and I want to quickly say this, is because a lot of times mental health care is always attached to substance abuse. And to your point, is not always attached to substance abuse. And so we have to get out, and we have to have programs that focus on mental health without it being attached to substance abuse. Thank you, Sherman, again, for asking the question.
Debbie, thanks so much. And then we'll go to James Hallrick, running for House District 7 as a Republican. James, sorry, I missed your hand. Go ahead, you have 2 minutes.
Oh, hold on, you have to unmute yourself.
There you go.
Okay, we good?
You're good.
Yep.
All right, yeah, the first thing is I'm a health insurance broker and I sell health insurance for a living. Unless as a unit, Delawareans, Republicans and Democrats join together to fix the problem, or it's never going to get fixed. And all everybody does is talk. I've been selling health insurance to people for 30 years. I can go on for hours about Aetna, United Healthcare, Highmark Delaware, and Cigna. We have no competition in the state, okay? The reason we don't have no competition, Christiana Care is the second biggest employer in the state of Delaware, okay? We have 7 hospitals, okay? They're the issues that have to be taken into this to get the money you guys want and the special the supplement stuff that we need to take care for health, for mental illness. That's one issue. I mean, it's got to be taken care of. But again, it's going to take both sides. I'm a Delawarean. I'm not a Republican or a Democrat. I'm trying to be a Republican because I like their ideals a little bit better, and it's nothing personal against Democrats. But at the same token, we have to work together to do that. The second thing, it's a village, as the old saying goes on the Democratic Barack Obama days. It takes a village to get people together. I listened to, I think it was Debbie earlier. She's 100% right. In my family, when I lived in South Philadelphia, my grandmother had every uncle, aunt, and relative in my house at times. Okay, I remember all those days. That's the real world. I get it. And the sad part is education.
30 seconds.
Okay, education's another issue. It has to be taken, and children's programs get involved with things besides sitting on the corner and hanging out. I can't be more bland than that, and I apologize if I was a little rough here, okay? But thank you for your time, guys. I appreciate it, listening to me. Thanks, Sherman.
James, thanks. And then I do see 2 more hands just pop up there. Michael Higgin, he's a Republican running for the House District 15 seat. And then we'll go to Robin Hayes. Michael, you have 2 minutes.
Thank you for having me. So the issue I see when one of the fixes that we can address mental health, and this is something personal to me, as I work in at a nonprofit foundation, we deal with individuals with mental health disorders. And there were 2 things that came to mind. The first thing was spread awareness. So first thing is we need to spread awareness to let the population know that mental health is something that is real and that it affects people. And there's various kinds of mental health issues that individuals deal with. And the second thing I would say that we can do to help the mental health crisis is to have resources for caregivers. One of the things I see every day, and one of the biggest issues I see is a lot of times the caregivers don't have the resources to properly care for the individuals with mental health. And sometimes the caregivers can be family members, it could be friends, sometimes it's even the professional nurses or CNAs that are working with these individuals with these mental health issues. So I think there's a lot of resources that's out there, but us as the candidates for these positions, if we can be able to harness these resources and make them readily available, not just to those that are suffering with mental health, but those that are closest to the individuals with mental health, such as the caregivers, to get them the resources and the help and the assistance that they need.
Michael, thanks. Robin Hayes is a Republican running for House District number 29. Robin, go ahead. You got to unmute. You're muted.
For the question, if you could repeat the question, I'd appreciate that.
I can kind of research. Sherman,
what was the original theme that is it just you would like me to speak about my thoughts on it, or was there a question?
Sherman, go ahead. You want to restate?
My question was, how do we help people that are homeless with mental health?
Thanks, Sherman.
So I'm in healthcare, and I'm a medical provider. I'm a dietitian, and I also work in the mental health realm. And it is evident in this state, as in other places, that we don't do the medical and the mental health well. We don't do them together. And I think one of the issues is that when different people have talked about different aspects. Obviously, this is a very complex condition. But when Mr. Halbrick was talking about him and the insurance, people can't often afford their bills. And that can put them in a homeless scenario. And if we don't have that piece together, in terms of the proper insurance and the proper resources that many of you are talking about, then the medical can take over, and that can bring down the quality of the mental health. That's one aspect that we have. And so when we find people that are homeless, part of what makes them homeless is their medical problem. It's not even just their mental health problem. So I think, first of all, we need to understand who is homeless. I've been doing a fair amount of work with the veterans population. With that population, we often talk about mental health and substance abuse, and I heard a little bit of that touched upon. And I think the low-hanging fruit is that you deal with the substance abuse, and you're not always dealing with the mental health component. And so usually if the mental health component is dealt with, then it's easier to address the substance abuse. I think another issue is that we don't have enough resources to pull people off the streets that want to be off the streets. Probably one of my biggest complaints about how our state government is run is that a lot of our monies are not appropriately spent. And where there's so much money out there, we do not have to raise taxes. We can pull money from other places and actually create appropriate housing. And there's another program I just heard about out of state that is working with a mortgage company to actually make it very possible for affordable housing. So there are many different aspects. I don't know if I addressed enough of what you needed, but that's a place to start.
Robin, thanks so much. And I think that brings us to the end of our first round, which went very smoothly. Thanks, everybody. Sherman, thank you so much for your question. Thanks for your being here. And I hope some of the answers were some of what you were looking for, and kind of helped us all kind of get a better understanding of where these candidates are related to mental health and how it affects homelessness, and vice versa. So we'll move on to round two, and our second question comes from another person with lived experience in this area, and that's Donna Moylan, who's been a Delaware resident for the last 30 years, and she's lived in Sussex County for nearly 20 years. Recently, her lease was terminated, and she needed to take her housing choice voucher to another unit, and COVID-19 has presented concerns about maintaining housing and homeless prevention. And seeking housing with a voucher can be a daunting task without a pandemic, even more difficult now. And due to the public health crisis, Donna has struggled to find new housing. She's working with the Community Legal Aid Society to find a new, safe, and permanent home. And so, Donna, thanks for being here. Ask your question to the candidate, but tell us a little bit about your story so we can kind of better understand where you come from, and then ask your question. And again, for the candidates, just raise your hand, and we'll call on you. Donna, again, thanks so much. Go ahead.
Thank you for. I'm grateful to be here, talking with you and everyone. My name is Donna Moylan. I'm a 62-year-old woman with health issues. I've been in Delaware for over 30 years, and I love it. I truly love it. I just had a horrible year. I had a place, I was living in a complex in Sussex County for 20 years. I paid my rent every month. I loved my community, and I never had a problem. In August or October, I can't remember, October, but one around there, August, I was up for recertification, which is a yearly based thing we do over there. We did over there with Section 8 and the complex, where you give your information every year, and you have a new lease. Unfortunately, I never got to do that. I was told that new people bought the place, and they wanted my apartment. So I seek help with legal aid. And this went on for months. I mean, months. It made me so sick with worry that I had to leave. I currently am looking for other housing. I have another voucher from Section 8, which has its limitation, mind you. And I am grateful for that voucher. I really am. I had it for 20 years while I was in that complex, and I'm grateful they extended it to me. But as I said, it has limitations, and I'm very concerned. I wake up every day wondering what's going to happen to me. So I basically, my question is, if and when you would be elected for councilman or senator, I would like to know, I know there's a lot going on right now, and believe me, I see it all every day on the news and hear everything, and there's a lot going on. But Even when I had my place, I saw it, and I tried to help. But if you're elected councilman or senator, what actions would you take to stop people from being evicted, or that horrible word I don't like, homelessness? Thank you.
Donna, thank you very much for sharing your story. First hand I saw go up was Kyle Evans-Gay, Democrat running for Senate District number 5. Kyle, you have 2 minutes.
Thank you so much, Mark, and thank you, Donna and Tony, for bringing her into this conversation. I'm so moved by what you said, and I have heard your voice and people who have been in that situation, your voice so many times in the work I do as an attorney and serving on the Delaware Bar Foundation, supporting our legal aid community in Delaware. And I am so much in awe of the work that Tony and his colleagues do, his colleagues at Classy and the other organizations. And I know that as much as the good that they're doing in this world to help folks who are facing eviction and who need representation in landlord-tenant disputes, they just can't do enough. There's just a greater demand. And with COVID, as we've seen, the demand has just drastically increased. One of the things that Delaware can, and I believe should investigate and move towards, is how we provide counsel to folks who are facing eviction. And, you know, this is a model from New York City that essentially provides the protections of Gideon in criminal cases to folks who are facing eviction and other landlord-tenant disputes. And we know that our 3 legal aid societies or services agencies, they just are overwhelmed and they can't meet the need. And so when we talk about access to justice statewide, we have to think about what that means for even some civil proceedings like landlord-tenant disputes. And especially when it comes to Section 8 questions, thank you, and public services questions, we need to empower individuals in those situations, and we need to empower the legal community here in Delaware and expect the legal community here in Delaware to come to the aid of the folks who need it most. And so I do believe that we need to continue to investigate that policy and understand, as our state continues to build back its budget, how we can fund those services on the civil side of litigation.
Kyle, thank you very much. Next is Lieutenant Governor Bethany Hall-Long.
Great. What I'll do is take a twist on this, because I assume probably others are going to talk about Classy and the legal side. The side that I'll talk about first is to acknowledge, coming from Sussex County, myself initially growing up there, I know from being out in the community, having participated not only there, but statewide in the point and counts that we do every year, working really hard as we go door to door in the hotels, as I go out in the community and finding families and children who are couch surfing. And to your point, I like to support and have supported when I was in the House and Senate, and continue to do so as Lieutenant Governor, to make sure we have the funding in place through our bond capital committee for affordable housing and also the infrastructure. And so the legal component is absolutely positively necessary, as well as making sure not only that we have the housing component, but during COVID, I want everyone listening in, because I'm not sure I'll have a chance to talk again before I have to leave for another meeting, is that we do have available funding now. If you visit de.gov/coronavirus, or you give us a call, we will be able to put you in touch for renter's assistance and other items. I recognize your question was very specific, though, to the kind of a legal renter, landlord, tenant discussion, and there are protections under Section 8 that I don't pretend to be the expert on. I am not an attorney, but to all out there, we have disaster relief
30
funds
seconds.
that will help pay for rent and coverage and mortgage assistance. I'm very proud to have worked with the Delaware Housing Alliance, and I know Carrie Casey was here earlier on with Newcastle County and the county to make sure folks have a roof over their heads. So again, we'll remain committed as much as I can to make sure the funds are present for housing.
Thank you, Lieutenant Governor. Then we'll go to Jordan Nally, Republican running for House District 4. Jordan.
Thank you, and thank you, Ms. Moylan, for your question. It's clear, just hearing your story and listening to you speak, you can feel your pain, and I can't imagine being in your position right now, especially with everything going on with COVID-19 and everything else that's happening in our state and our country during these times. I'm not an expert on the legal system. I'm not a litigator, as I feel as our Lieutenant Governor mentioned. But what I do pride myself in is collaboration and getting people at the table to talk through these issues. So all I can offer is if I'm elected as the state representative for the 4th RD, is hosting town halls like this, learning from constituents, talking through the issues, hearing your pain. Nobody should be kicked out of their house right now. We have issues, so much more going on in our state than just COVID-19. We have an education system that's failing students. We aren't bringing jobs to our states. We're losing jobs every day to competitors and outside states. And we really, it's a huge issue. And the problem of homelessness is obviously one facet of that. But what I can promise you, ma'am, is if I'm elected, I will talk to you. I will talk to other people in the community, and we'll work together to figure out what you need and what assistance we can get to get you back on your feet, and so that you don't have to be worried about where you're going to put your head down at night, because that's unacceptable for anybody, especially somebody that's supposed to be entering the best time of their life in their 60s. So thank you for your question and for sharing your experience with us.
Jordan, thanks so much. The only other hand I see at the moment is Robin Hayes, Republican, running for House District 29. Robin, go ahead.
As a healthcare provider, I'm often faced with scenarios just like this. And what I would say to this woman, I'm sure her situation is a little unique, but in many cases, she may, someone like her may be on Medicaid or Medicare, or even through her own commercial insurance company, should be able to obtain a care coordinator. And even though it may be not a direct medical or mental health problem, there are resources through insurance companies throughout the state that they can help and make connections that she may not have known about. And they may not be able to help the legal component. I appreciate the other comments about that, but it may also be another source of resources through her insurance company. Because as we've all discussed tonight, when you don't have a roof over your head, your health is at risk, both mental and behavioral. So believe it or not, an insurance company care coordinator could be someone that could be a resource.
Thanks, Robin. Then James Halbrecht, I see, raises his hand, Republican, House District 7. Go ahead and unmute yourself, James. And I've been told we don't have to apologize anymore for not unmuting ourselves, because everybody's done it 1,000 times. So no apologies are necessary. No apologies are necessary. Go ahead.
All right, Mark, I'm good. So yeah, I just want to say, the people that are in office right now, there's got to be agencies with this Mrs. Moylan can go to. Anybody could have put a hand there. Somebody can reach out to her when we're done here, guys. I mean, you guys are in the offices already, a few of you guys. That would be a big help to get her started, because I know for me and an insurance broker, I send people to state representatives' offices all the time for this stuff. So that's what, where should she go? That's my question to everybody on the panel. That's all I need.
All right, James, thanks. I don't see any other.
One last thing I would just like to say, and maybe this is more towards Bethany Hall Long, is since you are in the position of overseeing a lot of these services, perhaps there could be a decision tree that would be in place for healthcare providers or other people that identify these people in need, so that we are aware of where to go within the system. I would think that would be a really good handbook or website that could be created, so we are very well aware of the connections. I always appreciated the little booklet that you had when we all used phone books, but when that went away, a lot of those connections we had, it's hard to find them all through the 211.
And 30-second response, because again, I know I have to go somewhere else later, and I know we're breaking format, so I'll be really quick, is that we do have a program in place with your health background, something we call SRAP, where we have the Department of Health and Social Services, along with housing, along with a couple other Department of Labor and other, where we have resources in that kind of matrix, and obviously we need to get that out to you more. And I'll stop talking because I know we're messing up their format, but thank you for that question and comment, and thank you all, and good luck tonight.
Thanks, Lieutenant Governor. And I do have a couple other hands I see. Catholic Charities is on the chat tonight with us, and Donna can contact them directly at 856-09. There's too many numbers here, so I have the wrong number. I have 8 numbers and a phone number. I'll get the phone number right and get it back to you.
856-9578.
I have a 0. Okay, that's it. 856-9578. And that's the way that they can get help. Robin, thanks for pointing that out. And Lieutenant Governor, I think I saw Sarah McBride's hand go up. Did I not? Senate District 1.
Well, I was actually waving at Lieutenant Governor Hollong because she was leaving. But I will say very briefly, I think Kyle, hit the nail on the head. We need to make sure that people who are participating and engaging in our civil justice system have access to counsel similar to those who are a defendant in a criminal case. That is obviously a huge barrier to folks receiving justice, is they don't have access to counsel, or the counsel they have access to is totally overburdened with the caseload they have. I think the other thing that we need to enhance, we have protections on the books. I think we should enhance protections for renters here in Delaware to make sure that no one is facing unjust eviction. For those who are renters, they're at a severe disadvantage, particularly when they're dealing with a landlord who is a landlord for dozens or hundreds of people. So we need to make sure that we enhance protections here in Delaware for renters, particularly as more and more people, more and more young people are coming to Delaware and are renting instead of buying at the start.
Sarah, thank you. And that's just a warning. You got to be careful. Just like if you're at an auction, when you raise your hand, you just might have to buy the item tonight. So just be careful waving to people.
And I also want to thank Ms. Moylan for sharing her experience. It is really difficult being vulnerable and being vulnerable publicly. But through sharing her story, she's helping to educate all of us. So I just want to thank her for being willing to share her experiences and be vulnerable in front of us.
Absolutely. And I think I saw Michael Higgins raise his hand, unless he was also waving to the Lieutenant Governor. Michael, you're in.
No, I was raising my hand. I was trying to get your attention. But thank Donna for the question. And I feel your pain. And as stated before by Robin, being homeless leads to a domino effect where it has a negative effect on your health, physically and mental health. And from what this story that I hear is a lot of moving parts. And Donna, you did the right thing by reaching out to legal aid for assistance. But one thing I would say that as candidates or those that are currently holding office, I think one of the situations with the Section 8 vouchers is availability, as you did mention. And if we can more so expand availability for areas where the Section 8 vouchers are used or accepted, we can decrease the amount of individuals with this voucher that's essentially not doing anything or not helping, as we have in this situation here. So I think candidates or individuals, representatives from different districts can try to open up the availabilities for different landlords, whether they're personal or complexes or other locations, to use those vouchers.
All right, Michael, thank you very much. And I think we're going to move on to segment 3. Unless I see any big objections, which I don't. So Donna, again, thank you very much for your question. I think we're all moved by your story, and you're the kind of person this conversation is all about and is all for. So that's what it's all about tonight. Again, if you're just joining us or you just jumped on, it's kind of a conversation tonight with a number of candidates running for the General Assembly, for Lieutenant Governor's office as well. Tonight, talking about homelessness and housing issues. And we're having a lot of questions, several questions from those with lived experience in this area. And our next question comes from Darius Townsend. Darius first experienced homelessness at the age of 17, and Darius is non-binary. And many youth and young adults experience homelessness when they're forced to leave their homes due to their sexual and gender identity. And often they're seeking a place where they can feel safe. According to the True Colors Youth State Index, Delaware has made progress in addressing the needs of unaccompanied youth experiencing homelessness. Organizations such as PFLAG, Parents, Families, and Friends of Lesbians and Gays, support and serve as extended family for these LGBTQ, the community across Delaware. However, individuals of all ages who identify differently are met with challenges and sometimes harm when they need shelter and housing, and the stress and trauma of the social stigma combined with homelessness adds up to a really big toll. And so Darius is here to ask a question, and Darius, tell us a little bit of your experience and your question tonight for the candidates. Darius, thanks for being here.
Thank you. So throughout my process of being homeless, I've discovered that there hasn't been a direct path to needed resources. And I've contacted a number of agencies, 211, and then we've been inquired about SRAP because I'm disabled. So my question is, why is the path to resources so challenging when there truly is a need for support?
And we'll go to Jordan Alley, House District 4, a Republican. Jordan, go ahead.
Thank you. Thank you, Darius. And thank you again for sharing your experience. As a gay man, when I came out to my family, I was really afraid to come out to my family. My dad was a Vietnam War veteran, Purple Heart guy, tough as nails, and I was very lucky that after some time, he's come to grow and love and accept and be proud of me for who I am, and proud of my fiance that we've been together with. I've been together with for almost 9 years. I think when we're thinking about the problem of just all the hurdles you have to go through if you're experiencing homelessness, or really just any challenges where you need our state's help, we create such a bureaucracy where it's hard to navigate. I think it's highlighted a few times on this call. You've called 211. You don't really know where to go. You get passed around between operators who really have your best intentions at heart, but maybe they're not provided the best system on their end to know how to actually get you the tools needed. Something I do I'm employed at JP Morgan Chase as a process improvement operations analyst. We work hard to cut back some of this like needless loopholes where these processes that should be you call in. We're in the 21st century. You should have everything at your fingertips. There shouldn't be 24 or 48 hour delays. If you're in an emergency, you should be able to get help right away. So I think what we do is we elect officials who are going to look at the processes end to end. They're going to cut out all the BS and all the nonsense that happens and make sure that people like yourself that are, proud of who you are and are coming out but unfortunately might go through these situations can get the tools that you need so you can have safe, affordable housing, so you can go to school and get an education, and so that you can have quality healthcare and live a great, successful life. So I think what we need to do is cut a lot of the bureaucracy that we see right now and make these processes much more efficient. And that can be done with just looking at the full end to end.
Jordan, thanks. Next, we'll go to Eric Morrison, Democrat running for House District number 27. Eric.
Hi, can you hear me okay?
Yep, sound great.
Yeah, I was taking a few notes on what I wanted to say. So first of all, thank you for the question, and thank you for being, honest and courageous about your identity. I am a gay man myself, and I think it's wonderful that we will have, hopefully, we'll be electing our first ever 3 LGBTQ legislators this year, and representation does matter. With that being said, I worked in Medicaid and Medicare again for 13 years. I saw the bureaucracy, I saw all of it, and it is incredibly challenging. It does need to change. I saw, for example, in Medicaid where we had firm cutoff limits. So we would have people call and say, if I take this raise and I'm making $100 a month more, are you telling me that my entire family is going to lose our benefits? And the answer was yes. So, that's one example of where we need to look at, and we need to do some kind of grading and not just a solid, you make $1 too much. So, and that gets back to kind of the bureaucracy of it. So we do need to look at these programs. We need to cut out the bureaucracy. And we do see some of that happening now, and that's being spearheaded by Democrats. The other thing I will say is that, and I'm not touting myself here, I don't mean that, but we've got to have elected officials who are tenacious and just will not give up on constituent services.
30 seconds.
That's what we're here for, and we have to be committed to those and fighting as advocates, because we will have a lot of connections and a lot of weight that the average person will not have. I've already seen that in the constituent services I've worked on, so I think that's another important aspect of this.
Eric, thanks a lot. Next up is Debbie Harrington, Democrat running for House District number 9. Debbie.
Yeah, Darius, thank you for that question. And so, you know, I just wanted to say, I just wanted to speak to that portion you talked about in terms of having a disability, because I do quite a bit of advocacy work for people with disabilities. My youngest daughter was born blind, and she has cerebral palsy. So I have, now she's 24 now, but I have been dealing with the system in terms of making sure she had the right resources to live a safe and healthy and happy life. And I know firsthand that the process is cumbersome. And so I just want to say that you're right. We have to ensure, those of us who are going to be going into office, we do have to ensure, we have to work on making sure that people, that adults with disabilities don't have to maneuver such a cumbersome system to get to what they need. And so, and that's important. So, but, and I also, lastly, I'll just say that I'll ask you, have you heard of, or have you tried to access aging in adults with disabilities?
Yes,
that,
I have.
that department in health and
I have.
well,
That was
health and
actually one
human.
of the agencies that I contacted as well.
Say that again. I'm sorry, I didn't hear.
That was one of the agencies that I actually contacted.
Yes, yeah. That is the agency that deals with adults with
30
disabilities.
seconds.
And you're right, it is cumbersome, and we have to do, we absolutely have to do something about it. So, but thank you very much for your question.
Thank you.
Thank you, Debbie. Then we'll go to Marie Pinckney, and then after Marie will be Kyle Evans-Gay, and that's the last 2 hands I see. I see you, James. Yep. Okay, so Marie Pinckney first, Democrat running for Senate District 13. Marie.
Thank you. Hi, Darius. Thank you for your question tonight. We're all like outing ourselves on camera right now. So I also, Eric talked about some of the LGBTQ legislators that will hopefully all be going into the legislature this year. So I am one of the ones that's numbered, and I wanted to answer this question because that was an experience of mine as an adolescent too. My mother was not okay with my lesbianhood, whatever word you want to use. So I was put out of the house several times for that same reason, starting at a young age. I was able to turn to friends, so that was a situation that helped me. But from the other lens of the work that I do now as a case manager, I have experienced, my dog is trying to make an appearance in the camera right now. I've also experienced trying to do the interagency work, and it's difficult. You're so right about the challenges that it takes to be an LGBTQ person who is disabled, who is homeless, and trying to pull together all of those resources that should, because you have access to all those resources for those reasons, you should be able to be lifted out of that. But you're right, it's difficult to work among so many different state agencies that have failing systems. It's one of the reasons that I decided to run for office, because I'm a social worker, and it got exhausting to try to continue to navigate broken systems that we pay into, that should be saving people, that should be picking people up, and I was tired of that. So I think one of the most important things that we really need to do, again, is coming back to my case management hat, is strengthen insurance programs that are already working with case management, so that you have someone who is able to navigate those systems, so that you're not the one making hundreds of phone calls a day trying to pull together the resources that you have. You have a social worker or a case manager who can do that for you, who can advocate alongside you, and who can listen and really fight for the resources that you want and that you deserve.
Marie, thanks so much. Next up is Kyle Evans-Gay, Democrat running for Senate District 5. Kyle.
Thank you, Darius, for giving me a chance to talk about something super boring, which is government efficiency. And here's the thing is that everyone on this call believes that the government should work for the people. And that's probably why a lot of us got into these races, whether it's on big issues that we really care about or the day-to-day. I'll be honest with you, I come from a place of great privilege that I have to acknowledge every day. But I saw as a sick child, my mother deal with all kinds of hospitals and specialists in care. And when there wasn't the great internet access and portals to call in, and she would sit there for hours while she was working a full-time job, just trying to get me everything I needed to be better. And we see now, and I get calls as a candidate from people who just can't get through to deal with their unemployment issues, right? Every piece of our government needs to work for us and with us. And I think when we're thinking about candidates and what they bring to the table, it's passion, yes, but it's also a determination of we will sit down at those desks down in Legg Hall and go through the code and make sure that the system is working for all of us. And I think that's what's so great about 2020 is we see so many new faces with just diverse backgrounds who are going to bring all of those experiences to bear so that we can make it better because we are living it. And so thanks for letting an attorney talk about boring law code issues. I really appreciate that tonight. And thank you for sharing.
Thank you.
Kyle, thanks much. Next is James Halbrick, House District 7, a Republican. James, I think you're on mute again.
Here we go.
Boom.
I'm on now, right?
You're good.
Yeah,
Yep.
I'm an insurance broker. I take care of people's problems every single day of my life. And it's the same bureaucracy, believe me. What we have to do when we all win, hopefully, and I want to be in there as a Delawarean first and a Republican second, not a Delaware or a Democrat. I'm a Delawarean. Okay, I want everybody to succeed in the state. One of the biggest problems when you bureaucracy, what Kyle was just saying, that's life. You got to dig in, and as candidates and people we work, you have to have staffs that are willing to work hard and help these people. And again, there's agencies for everybody, but you got to dig hard and you got to dig deep and hard. And that's just my pitch to people. I agree with everybody. It sucks lifetime. Everybody has these problems in life. Every family has disease at times. They have things that go on. And I agree with it. And Darius has got a tougher situation than most. I agree with it. But the point is, sit there, we're just talking about it right now. Like, God forbid, because I have to get to another meeting. I pray to God I meet all you people at January time, meet everybody, say hello, and get down to business. And let's get the work done for the people, as Kyle said earlier. And I'm down with that too. I really appreciate my time tonight with you guys. Thank you so much for having me on the bubble here. And it was great. Thanks a lot. And tell Erin the same thing. I'm glad I did it. All right. Have a great day, guys. Bye.
James, thanks so much for joining us. Appreciate your time.
God bless. Bye.
Next up is Sarah McBride, a Democrat running for Senate District 1. Sarah.
First off, Darius, thank you so much for the question. Thank you for sharing so much of yourself with all of us. I have two quick thoughts that I just want to add. One is we have to recognize that so often we think putting resources out means putting it on the internet, and that's basically a job well done. And we have to recognize that particularly for vulnerable communities, particularly for folks who are struggling with housing insecurities, that's not enough. We have to put the resources into the communities where people are. We have to get resources to people and meet them where they are. And so I think that's so critical, particularly as we're having this conversation about folks struggling with housing insecurity, to make sure that the information isn't just posted online or offered through a number, but that we're actually going into the communities that are impacted by these issues and talking to them, having those conversations. And the second thing I'll say to build on what a couple of the other candidates have said is I too am an LGBTQ candidate. I'm a transgender woman. I was proud to be part of the successful effort here to ban discrimination based on gender identity in a number of areas of life, including housing and public spaces like shelters. But one of the things I know in the work that I've done is that legal equality isn't enough. It doesn't always trickle down into true lived equality. And when we're talking about the LGBTQ community, and particularly
That's our first frozen of the night. Sarah, are you there?
Yes, can you hear me?
You're back.
I paused your time, but you're at 30 seconds.
Okay, but one of the things we have to make sure is that all of these services are truly inclusive and affirming of LGBTQ people, because so often we are going into these situations, into receiving services, not knowing whether the provider is going to actually be affirming of our identities and who we are. And so we have to do a lot more to make sure that all of the services, all of the shelters, everything available to people struggling with housing insecurity are truly affirming of the LGBTQ community.
Thanks, Sarah. And Jim Bianchetta, I wanted to get you in. You're not a candidate for anything tonight, but you work with Darius, right?
That's right. I just wanted to make a couple of comments. There's only one reason that Darius is not literally on the street tonight. He reached out to, I'm the president of PFLAG in Northern Delaware. We have a helpline. He called our helpline. I had a conversation with him. I didn't know exactly what to do, but I knew somebody who might. And that person knew somebody who did. And that person contacted 2 or 3 other people, cut through a bunch of red tape. And as a result, he got a voucher for his hotel stay. And so the other issue I wanted to reinforce that I've heard from so many of you is that part of the problem is that there's just no one person who has had the time or energy or both to take the time that is needed in Darius's case to understand Darius's full story. It is a very complex, very much different than the traditional cookie cutter situation. And as a result of that, you know, he's not getting the support that he needs to have.
Thanks, Jim, for clarifying that and adding. I had up next Luann Agostino. She's a House District 22 candidate, a Democrat. Luann?
Yes, thank you. Thank you for having me tonight. Thank you for sharing, Darius. Just really quick comment. Yes, totally agree with everyone. We need to improve the efficiencies in government. It's great to have the programs, but if you can't get connected to them, it's a huge problem. Wanted to make a big shout out. I'm very involved with volunteering in a lot of different nonprofit organizations. And I need to just say hats off to the many nonprofit organizations that we have in our community that actually, I think, do a much better job of helping people like Darius get connected to the right programs within our government and our state. You know, I would hope that our state could do that, but definitely it's very important these nonprofits fill a gap that we have not been able to figure out yet how to make government totally work for our people. And they seem to fill in that gap and get people to the right places and help them understand exactly what is available to them. So that's very critical. I think we need to keep that in mind because I know every year it's an issue with funding and how we help nonprofit organizations. And I think we need to really look at the big picture of what they're doing for our community and make sure that funding continues to go to them so that they can help people like Darius.
Luann, thanks much. Our last candidate, I think, on this topic will be Michael Higgin, a Republican running for House District 15. Michael.
Yes, thank you. So I hear the struggle that Darius is having, and to me, when I step back and I look at the entire picture, it sounds like the system is clogged. And so what we need to do is kind of disrupt the system a little bit to fix the system. And the issue is, I think the burden on the government is a little bit too heavy. So when individuals such as Darius needs these services or apply for the services, they're not readily available as they should be. So one of the things, and this is one of the issues that I'm pushing in my district, is to bring jobs back to Delaware. And by bringing jobs back to Delaware, number one, we would have the employers who would provide insurance for a lot of these individuals. So a lot of them wouldn't be so dependent on some of these government programs. Also, if we can have employers who will be able to employ many individuals who have disabilities as well, so that when we can decrease the burden off of the state government and we kind of spread it out along smaller businesses, then those individuals that are in the government that cannot work or cannot access the resources that other people can access, they're more readily available for them. And another issue that I've spoken with a lot of individuals and it's referred to as the cliff effect. And individuals that are receiving benefits, they would receive a certain amount of benefits.
30 seconds.
Start working, and the benefits, after they get to a certain amount of income, the benefits completely drop off. I think an alternative to this would be to taper off the benefits more of on a sliding scale instead of on a step scale to completely rip the rug from underneath people. So I think bringing back jobs and tapering the benefits would be a solution to this issue.
Thank you, Michael. And that wraps up that round. Darius, I want to thank you again for sharing your story and asking your question, and appreciate you being here tonight and being so open and forthcoming with us, and thank you.
Thank you.
So that takes us to our fourth question from someone who has lived experience in this area. Before we get to the fourth round, I want to recognize a couple of candidates I think have just joined us. Lieutenant Governor Republican Danielle Halls joined us now, and also Krista Griffith, Democrat, House District number 12. So thanks for being here. So just raise your hand when we get to the question time, and I'll get you in if you want to weigh in on these questions. So our fourth question comes from Terry Williams, who's here with a service provider's perspective. Terry holds a degree in administration and human services and certification in trauma-informed approach. She's worked in the human services field for over 25 years and is currently employed with Henrietta Johnson Medical Center as homeless program manager. Her work involves advocacy and providing resources, including housing options to people experiencing homelessness. And Terry began her work providing supportive services for veterans and their families here in Delaware. Terry, thanks for being here. We appreciate your time and your work. Tell us a little bit about your background, your story, and your question.
Well, thank you, Mark. Thank you for having me tonight. Yes, my name is Terry Williams, and I am a service provider at Henrietta Johnson Medical Center as the homeless program manager. And actually, I too have been homeless. So I have been a part of this population, and I understand the trials, the tribulations, and the challenges that go along with being homeless. As a homeless program manager, I see a lot of my homeless clients that come in to get medical attention. But the process of getting medical attention and being able to sustain good health is predicated about having housing. And what we see as working with the clients that I work with on a daily basis, they come into the office, they're seen by a doctor, they received a prescription for medication, but they're released back into the community. They have no housing. They cannot get into a shelter because they have to go through our Housing Alliance Delaware, our centralized intake process. Recently, I actually have a patient that came in, was released from the hospital with COVID. She actually had a place to live, contracted COVID-19, was hospitalized for a few days, was released. But because of the home that she lived in, people were afraid to let her back in the house. So she became homeless overnight. Coming to, meet with me, well, over the telephone, having conversations with this person, trying to link services were almost impossible. Because one, especially during this particular time that we are in, COVID-19, the staffing is a skeletal ship for most places. We have one person doing a job of 2 and 3 other people. There are so many delays in receiving callbacks. The shelters are not always taking people. And again, because this particular patient is recovering from COVID-19, the chances of her getting COVID again is high, very high. Because one, she does not have a place to live. 2, she does not have a place to even get her medication and to store her medication that is needed. She's not able to come back and forth for her treatments. There are so many different aspects to our people that are not housed. When we talk about mental health, we know, each and every one of us, how stressful it can be. But to have on top of being homeless, whereas you don't know the next place you're going to lay your head down, whether or not you're going to be criminalized for trying to sleep in a park, whether or not you're going to be put out of the hospital, you can't no longer stay in the emergency room. So those that are used to going to the emergency room to try to get a stay overnight, to just try to get something to eat, to get warm, they are no longer allowed to do that. So they're immediately put back out on the streets. And inclement weather, raining. Now that the weather, the temperature is dropping. So how, the housing, when we talk about the housing prospects for our homeless, one, to even get those that we work with to get signed up for SSDI is a very tiring and tedious process, even for them, because we have to locate them, we have to get history from them. Many of them, because of their circumstances, their mental health, they cannot even recall the last 2-3 address because they have been in transition for so long. I have a patient that had been homeless over 14 years. 14 years homeless.
Sorry, we're coming up on time.
Couch surfing. So the help that we think that's out here, the resources that are supposed to be out here necessarily for our patients and for our family and friends are, again, what we have already been talking about, are not easily accessible. For our patients that do not have cell phones. So how are they going to get in contact with 211 if they have no cell phone? The ones that have Obama phones, they run out of time quickly. We really need to have some kind of kiosk in the community where they can charge their phones up at if they are homeless, so they can really have access to 211, 411, and any other resources that's needed for them. But again, I like what Luann talked about, the small businesses. There are many small businesses that actually link up services more quickly than some of the other traditional resources. So it's important. So my question to you is, how will you also make these landlords, property owners, motel managers, the ones that we pay money to house our homeless in substandard living conditions, how are we going to be able to help you all make them accountable to the monies that they receive for the services that they're supposed to be rendering that are substandard? How are we going to make people responsible and accountable for the money that we're spending? Thank you.
Thanks very much, Terry. I appreciate your experience and sharing that with us. I saw Eric Morrison, Democrat for House District number 27, up first. Then I have a couple more that we'll get to, but Eric up first.
And thank you for sharing what you did, and thank you for all that you do. And I'm not going to answer your question per se, but here is what I'm going to say. In my view, we need people like you in Dover. We need people like you being listened to by legislators. We need people like you on committees. I think too often our committees, our task force, all of that get loaded up, frankly, with special interests, with people who don't know necessarily what they're talking about. They don't have the experience, the real life experience. I just defeated a 12-year incumbent who chaired the House Education Committee, but he had never worked in education a day in his life. So we see something we call the Delaware Way that happens across Delaware and down in Dover, where you get people leading these commissions and committees and different things where they just don't have the real life experience. And you end up with a lot of them bringing special interests to the table. When they're doing task force, they're full of special interests. They're not full of people who know things, real things, boots on the ground. So I think, in my view, that we have to have elected officials in there who are going to pull in people like you, because we cannot possibly be experts on everything, and we cannot know what is really going on the ground without getting people like you involved. We have to reach out to you and bring you in and bring the community in.
Eric, thanks so much. Robin, did I see your hand go up? Yeah, Robin Hayes, Republican, House District 29, go ahead.
Terry, I used to work at Henrietta Johnson Medical Center. I'm sorry we didn't meet during those times, but you are one of our unsung heroes with what you're doing. And I think your scenario that you've just described is really pulling together all the issues we've talked about. And I think as the healthcare provider, we're always on the front line. We see a lot of it, but we don't know where all to go. From what the current Lieutenant Governor said, there is a system in place and it's not well communicated. And it probably should almost be on billboards, you know, just for the reasons you're saying, because the people that need the services don't even know where to go. And those of us that might be able to help don't even have all the resources. And she didn't give herself credit, but the Lieutenant Governor had put together a wonderful booklet when she was not the Lieutenant Governor of all kinds of wonderful resources, but it was in paper. And then one day it disappeared and everything went online or 211. So it's been really hard to connect all the services to the right people. That being said, you know, I totally agree with what Eric said. One of the reasons I'm running is because I was fortunate enough to sit on a committee, a task force, and I was one of the few people actually in the trenches that was a clinician on a topic, and all the others had never even done what we do and didn't understand what they were putting together in a white paper. So I totally agree. We need a better system. And what Jordan is all about, I'm all about continuous quality improvement. I hope that all of us get in because we are real people and we're not politicians. You know, we are problem solvers every single day. All of us do that. So I just wanted to thank you, Terry. And you know, you really have embodied what is possible, and you've survived it yourself. And you've come back. Thank you.
Robin, thanks. Next up is Jordan Alley. Jordan's a Republican running for House District 4.
Thanks, Mark. And thank you, Ms. Williams, for your service, for your insight. I think to Eric's point, that's the most valuable thing of these forums. And if I'm elected, what I, again, will, as I've said a few times now, is pulling folks like you into the conversation and understanding your background, your perspective, and what we can really do to bring some real change to Delaware. I think something you hit on a few things, and I know I only have 2 minutes. Something that's really big that you mentioned, though, is if you don't have a cell phone, if you don't have access to internet, how are you going to get these resources? And that's why I'm very passionate about making the internet a public utility in Delaware, where we can start getting internet access to family. We're in the 21st century. The internet is needed for everybody. So if you're experiencing homelessness and you're in a voucher situation where you have to use a voucher to get home, you should be able to access high-speed quality internet so you can still communicate, so you can still get educational resources, and so you're not missing out on other opportunities. I loved your idea about the kiosks. Like, okay, we used to all see telephone booths everywhere. Miss Williams coming through with like a great idea on kiosks. Like, if you need to, I've seen it so often where people go into a Starbucks or a Dunkin' Donuts and there's a young person sitting on the floor with their phone plugged in. They need a safe place where they can go and know that they're not going to be kicked out because they're using up a little bit of electricity. And I think that was a brilliant idea that you brought forward. Something else that I'd like to touch on is we see there's this book by Harry Washington, A Terrible Thing to Waste. And so often we have, and it's about our systemic racism and environmental racism that's happening to so many communities. So if you're on a voucher system, you're placed into a specific part of the city where you might not have quality water, where your water might have lead poisoning, and where we don't have proper testing. And those have huge behavioral impacts and developmental impacts that obviously it follows you throughout your whole life. So I think there's so many things we can learn from one another and work together to improve the quality of healthcare and housing for all Delawareans. Thank you.
Jordan, thanks. Next up, Michael Hagan, Republican for House District 15. Michael.
Thank you. Hey, Terry. I've worked with Terry personally. Terry's a really good person. She's genuinely nice, and it's a pleasure meeting you again digitally. This is personal to me because Number one, personally, I am a landlord, and two, I also work in the legal field. So I think there's a few things that we can do to combat this situation. Again, I hear multiple issues and multiple moving parts when I hear the situation. The first thing I think is when we are giving these resources to these individuals is landlords and tenants both need to be aware of their rights. And I think sometimes that doesn't happen. Second thing I think is sometimes we can do this by building a good relationship between the landlord and the tenant. And by doing that, I don't think relationships will drop to the point that these tenants are then living in subpar conditions. And I'll give an example. Say, for example, there's a broken faucet or something goes wrong with a unit and a tenant agrees to fix it, or the landlord responsibility is to fix it. You know, I think if we build a better relationship between the landlords and the tenants, then these individuals will be less likely to move from unit to unit. So I think that's another thing that we can do. And that third thing I think we can do is also teach these individuals fiscal responsibility and independence. So when we're giving them the resources and giving them the money, I think to teach them how to manage their resources and their funds every month is a very important aspect, because just giving it to them and they don't know where the money goes or don't know how to properly use money for themselves, we're not enabling them, but in a sense we're disabling them, because the idea should be to give them the resource and the knowledge and the information that eventually they can, that they're independent instead of just doing it for them. So I think educating them and giving them the mental knowledge for the resources. Thank you guys for having me. I'm gonna run. I'll put my information in the chat box so anyone who needs to get in touch with me can reach me. Thank you guys for having me.
Michael, thanks so much for the time. Appreciate it. I see a lot of people waving, and I recognize that that's what that is now. It's people waving. Michael, goodbye. Go ahead, Terry.
Can I make, because I want to clarify, when I talk about accountability, the accountability on the part as when monies have been received by motels and vouchers that have been received on behalf of our patients, they are being moved into substandard housing living conditions, such as motels that are infested with roaches, prostitution, drug dealers, and things of that nature, which then, you know, has a ripple effect on our patients. So that's what I'm talking about, the accountability of the money that the state service centers are putting people in motels, but there's no accountability to how that money is being spent, and especially putting our homeless personnel inside of those motels that are not suitable, especially for those that are suffering from mental health disorders and in drug infested and, you know, high crime areas. Those are some of the things that really need to be addressed. Where are we spending our money? How are we spending that money? And why are we spending it that way? We spend $1,200 for a person to go into a motel when we can stabilize them in an apartment or, you know, another living situation that's going to be more stable and long-term.
Terry, thanks for the clarification. Michael, thanks for your time being with us. State Rep Paul Baumbach is with us now. Just recently joined us. He's running for re-election in House District 23 as a Democrat. Paul, go ahead.
Thank you. I think I'm going to ramble for 2 minutes and just cut me off. So I served on the board of the Newark Housing Authority before I ran for office. So I've got some background in affordable housing. I know that in my 8 years down in Dover, I've really appreciated what Housing Alliance does in bringing what's happening in the streets to us. Some of us are able to maintain contacts in the community with those who are without shelter. As an example, and you mentioned the housing for those who are otherwise homeless during coronavirus, we in Newark had sort of that pop-up testing with the hazmat suits and stuff in April. And I was frankly apoplectic that we could not get housing for these individuals. This is back when it was snowy time in early April, and the money just wasn't flowing. And the CARES Act money was promised, but it wasn't in the hands of the agencies to be able to put it out there. Since then, DHSS, including under DSAMH, has housed hundreds of families who otherwise would be homeless using CARES Act money. And we're working now on making sure that they have, the children from those families have access to educational support. And we're really piloting that in Newark and then hope to expand it across the state. But I think that the important thing for legislators is to stay in touch with your district, stay in touch with the local organizations that are helping these communities so that you can ask them to keep you in the loop of what's going on. And when they hit a brick wall with state government, that's when you come in and you try to get them to crest that wall. I think there's a lot that we can do in partnership, but largely it's recognizing the role of state government and the role of the local partners to try to get this. There's been a great move during coronavirus when no one wants to go travel and use hotels. These motels were happy to partner with DHSS to provide this housing. Thank you.
Thank you, Paul. Krista Griffith is next, Democrat, House District 12. Krista.
Thank you, Mark. And Terry, thank you for your service and for your questions. This is a question that we need to constantly ask ourselves. And the basis of it is we live in a really difficult society when the choice between a roof over your head or living outside in a park or a car is safer, you know, because the housing options for homeless are substandard. And that's essentially what your question asks, which is, you know, and especially in this time of COVID, like who wants to go live with roaches and with people packed in where the spread of this virus is even more significant and severe. You know, I go back often to a thought when I'm thinking about homelessness and really your question and a lot of insight that you brought to this discussion this evening when you bring the fact that the simple fact that people can't have their phones charged, you know, really was not a thought. And I'm going to be honest and frank with you. That had never occurred to me before this very moment this evening. And if I leave this discussion with this one point, it is so salient and so important that now I have a new challenge, which is how do we get stations for people to be able to charge their phones. But what I'm going to go back to is an experience that I had as a deputy attorney general when I was prosecuting domestic violence and child abuse cases. And one of the most important victims that I ever met in my encounter was living in a tent community. And I had to learn how to communicate with her to tell her when her court dates were going to be happening, et cetera, and how to convey information to her. And it is a constant struggle, and it's a constant issue that what I'm reminded of is we need to keep talking with you so that every day you're going to present me with a new challenge. And today my challenge is how do I get charging stations to folks that are homeless? And as we approach and answer these simple questions, we'll be thinking about the bigger picture. And I want to put my information in the chat because I would like to follow up with you and meet with you. Thank you.
Krista, thanks so much. And I think that's the end of that round, unless I see anybody raise their hand. Okay. So that kind of, Terry, thank you so much for your time and for your experience and sharing your wisdom with us about insights into this issue, as you know better than maybe more than half these boxes for sure that we're looking at tonight. Terry, thank you very much for your time. So that kind of brings an end to our lived experience questions. And so now we're stuck with just questions asked by me, and I apologize for that. But I think there's a really good question based off of the Housing Alliance Delaware recently recently published a report on the racial disparities in housing access in Delaware. And one of the points that they found was that based on the 2020 point in time count, families with children where the head of the household is Black African American are 8 times more likely to experience homeless than families living with a white head of household. And domestic violence, including economic abuse, is often a driving factor in those families' homelessness. So with that in mind, what legislative action or strategies do you envision to help reduce that disparity? How can we solve that problem? And let's try to answer these questions quick, and then we can get into maybe another question as well. And I see Krista Griffith, House District 12, a Democrat, first to raise her hand on that one.
All right, thank you. It's a great question. And I just attended a seminar today on economic justice and domestic violence. And one of the key issues with that is, of course, homelessness, which I just mentioned. And part of that process is making sure that there's economic stability so that individuals who are facing violence don't lose employment because of what the violent situation that they're enduring causes them. Oftentimes homelessness is caused when someone can't afford to keep their job because of their life and their safety, and they need to move from their home and they need to go attend court hearings, etc. So I am working currently on legislation that will create some workplace protections for those who are encountering sexual or domestic violence, so that they could potentially have some sort of safety net so that they can keep their job and not fear losing it because they need to file for a restraining order or take some other important steps. So it's early in the process. I'm looking forward to working on it and working with advocates and survivors of abuse. But I think that that's one aspect that I think might be helpful.
Krista, thanks so much. Marie Pinckney, Senate District 13, a Democrat. Marie.
Hello, hi. Thank you for a really, really great and important question. I'm so glad that you asked it. I don't think there's any one legislative response to inadequacies and disproportionality and race issues. I think that as we legislate, that we need to make sure that we are keeping anti-racism in the forefront of our minds in all things, that we, sorry, my dog is being a dog in the background. I think that we need to always keep in the forefront of our mind that Black and Brown communities are disproportionately affected in almost every scenario. We're always at the top of the list for disparities. We're always at the top of the list for healthcare inadequacies, for homelessness, for almost any social issue. You see Black and Brown people at the top of the list for those issues. And I think that as we legislate, we keep that in mind and that we're intentional about the way that we legislate and the policy that we produce, and that as we produce that policy, we're keeping those things at the forefront of our mind, and that we are saying and producing policy that specifically states that we will not continue to allow Black people, Brown people, LGBTQI people, people with disabilities to continue to be the ones that suffer the most simply because we're afraid to have the conversations about them because they make people uncomfortable. We have to be willing to have uncomfortable conversations that recognize that these are issues that have been going on for so long that we're tired, we're afraid to talk about them. We bring them to the forefront of our conversations, and we produce policy that keeps that in the front of, that keeps that first and foremost in mind as we produce that policy. Thank you.
Marie, thank you. Jordan Alley is up next, House District 4 Republican. Jordan.
Thank you, Mark. And to Ms. Pickney's point, I agree with a lot of what she said. There's not a one-size-fits-all solution. There's lots of aspects that we need to address. I think personally, to me, I'm very passionate about improving our education and quality of education in Delaware. When you have 88% graduation rate, but only around 56, 58% of those students are career and college ready, of course we're setting students up for failure, and then they go out and have to pay for housing, which is astronomical, and then try to find quality jobs when jobs are leaving, or they're not being provided the tools needed to be successful. As a mentor with the Year Up program, a program that partners with Wilmington University to try to bridge the economic divide in our, especially in our communities of color, and with folks that are that may just need a little bit of a helping hand and a little bit of extra resources to get where they need to be in life, or where they want to be in life. I've seen firsthand that with just a few classes and access to transportation and reliable internet access and cell phones, where they can make phone calls and go on job interviews and talk to employers and get some soft skills to do better in the workforce, I've seen how quickly individuals can turn their life around, going from meaningless jobs where they're minimum wage jobs to a meaningful career in just 1 year. And that's through just one program, through the Year Up program. But if we look at our what we're teaching students in our schools, if we look and make sure that they're getting financial literacy classes, that rather than focusing on legislation to make sure kids are learning cursive in schools, but that they're learning coding and they're learning skills that are going to be able to take them and propel them into 21st century jobs, I think we can start to break down some of the divide. Thank you.
Thanks, Jordan. Up next is Paul Bombach, Democrat in House District 23. Paul.
Yeah, I guess I was forming my answer when I was hearing Representative Griffiths. I think a good way of working in our state legislature is by finding out what is working across the country. And I think that, Ms. Pinkney also pointed out that we need to admit the problem and actively search for the solutions. Let's find out what some other regions are doing that's successful, and let's not be afraid to bring it forward. I think we need that broad groundswell of support for that. And I think we need to, again, work with advocacy groups like Housing Alliance to bring this forward. I think we've got an extremely different legislature than we had just 4 years ago. So I think we've got a target-rich environment for making meaningful changes to really move the needle on this issue. And the question just lays out in stark detail how bad things are and how it's way overdue to take steps that will not be easy, and they will be ones where we're addressing the needs of people who are otherwise quiet and ignored in Delaware, and we need to end that. So thank you for the question, and hopefully together with the people on this call, we can make a difference starting in January.
Well, thanks so much. I see Danielle Hall, Lieutenant Governor candidate, a Republican. Go ahead.
Well, I apologize for coming late to the discussion. I've kind of just been collecting my thoughts around the subject. I just wanted to chime in. Racial disparity through a lens of looking at it as Black and brown people occupy about 23% of the total population in Delaware. Right now, we're seeing a prison population of about 60% Black and brown people. And one of my things that I have found to be very concerning, I have a mentally ill younger brother. He has issues with recreational drug use and suffers with homelessness. And I see that there's some overlapping concerns with that. My problem is that when we moved away from long-term health care for mentally ill patients, now what has to happen, and it's something I've been battling with for the better part of the last decade. He was living with my parents. There was some abusive issues going on there. And until he had enough encounters with the police, there wasn't anything that could really be done for people like him. So you find that there are homeless people on the streets who have mental illness as an underlying cursor, and they can't get services because they have to have interaction with the police, which ends up putting them in a criminal pathway. And sometimes, they still have the ability to not go to the mental health court, and they're still not getting services. So, on the legislative side, the lieutenant governor doesn't necessarily weigh in on those things, but as an influencer, those are things that I would feel would be necessary for those of you who do hope to be legislators to take into consideration, is that, we still have that mental health aspect that is contributing to homelessness, and that needs to be addressed as well. So those are some of the things that I would like to just interject while you're thinking about legislative policy in that regard. Thank you.
Thank you. Appreciate that. Seeing no other hands up, I'll go to the next question. And this is a question that was submitted tonight by someone watching. Rachel wants to know would the candidates here support source of income protection that would prevent landlords from denying housing to people simply because they have housing vouchers? Any thoughts on that from anyone tonight? All right, I see Paul Bombeck raise his hand, then I'll get to Robin next. Paul, go ahead.
Yeah, and I'm sort of smiling because I think I voted, or at least indicated, opposition to an earlier version of this. It depends. I believe in the concept of it, but it cannot force a landlord to participate in the voucher program, the Housing Choice Voucher Program. And the reason is that the federal program, and I served on the board of the Newark Housing Authority for a few years. The federal program for housing choice vouchers has high standards, and not every landlord is going to meet them, and we should not be requiring every landlord to meet them. So if somebody has a voucher and the landlord doesn't want to meet those high standards, we cannot compel a landlord to meet those standards, and we can't have somebody use a voucher at a substandard location. So we should not be, I think there were also landlords who are saying we don't take vouchers and using that as an advertising tactic, and that's terrible, and that should stop. But we have to be careful in how it's written, and we can write it well. It shouldn't be something where source of income, whether if you meet the income level, whether it be from public assistance or from a job or a combination, that should not be used to discriminate against housing. But again, you should not, and we should not do legislation that compels a landlord to join a program that has very high standards. When I took a tour of the Newark Housing Authority units throughout the city of Newark, they were some of the best maintained units in those communities, again, because of the high standards. And I love that, and let's not detract from that. So I think there's more to it than just the surface, the headline of it. Sometimes the devil's in the details. So I'm a big believer in public assisted housing, but I think we have to be careful of exactly how we make it happen. Thank you.
All right, thanks, Paul. And then we'll go to Robin Hayes, Republican running for House District 29.
And I have to sign off in a few minutes, but I wanted to summarize most of what we've said tonight by saying that I think when we use continuous quality improvement type processes and we look at the whole picture, I think what would benefit all of us as we move forward and become legislators is we should all be sitting down at the same table, putting down all the pieces that we see, because all of us have different perspectives and we're all bringing ideas to the table that maybe someone else hadn't heard. We maybe didn't think of this population or think of that. And I think what would help all of us is really putting it on paper and looking at where the commonalities are, what are the chronic systemic problems? Has it been policy? Has it been just a bias that's been in place for too long, that's never been effectively addressed? So I must sign off, but I've really welcomed the conversation tonight, and I look forward to being part of the solution. And thank you very much. Appreciate it.
Robin, thanks so much. Thanks for your time and joining us tonight. Seeing no other hands, I'm going to move on to another question. So with where Delaware's minimum wage is at right now, at minimum wage each week, you'd have to work 78 hours to afford a modest one-bedroom apartment rental at HUD's fair market rate. So the question is, where do you stand on a living wage, and what strategies would you put forth to ensure that all Delawareans can afford their housing? And I see Representative Baumbeck again first. Go ahead, Paul.
Okay, I'll be quick. I fully support getting our minimum wage up. I'm especially mindful of what the minimum wage is in Maryland and New Jersey, and we should not be racing to the bottom on that. And all the weak arguments that so many of my colleagues argue just fall apart when you look at the long border we have with Maryland, and oh, we're going to lose jobs. Well, not when the main state next to us has much higher minimum wage. We need to be raising it. We need to be keeping up with our neighbors, and that helps everyone. That raises all boats, that rising tide. And then we should be indexing it also with inflation once we get up to a meaningful level. We've fallen far behind, and it's been on ideological battle lines, and it's time to throw that out the window. And we need to put the people who work the hardest at some of the hardest jobs, and we need to make sure that they're paid a fair wage. Thank you.
Thanks, Paul. I see Jordan Nally next, House District 4, Republican. Jordan.
Thank you. I don't believe in aiming for minimums. I think we should aim for the stars and shoot for the stars. We need to create economic opportunities in Delaware. We need to bring businesses to Delaware. Under a Democratic House and Senate, we still have cannabis that's illegal, where we could have a huge industry of legalized cannabis that could bring new opportunities, that could bring new jobs and more money to the state. When we think about education, we have I guess I mentioned before, we have an education system that's setting students up for failure rather than success. We need to be arming students with skills that are going to prepare them for 21st century jobs and careers. We see Barclays sending more jobs to New Jersey, to Jersey City, and more jobs leaving the state each year, when Delaware used to be an economic hub and an attractor to so many corporations. So what I think we need to do is we need to stop aiming for minimums. We need to shoot for the stars. We need to ensure that our students are being taught what they need to be to get meaningful careers in the 21st century. And we need to start attracting businesses to the state of Delaware and stop accepting last place. Thank you.
Thanks, Jordan. Next is Debbie Harrington, Democrat running for House District number 9. Debbie.
Yeah, thank you. Thank you, Mark. So I had this conversation today with a voter he's actually a business owner. And so we were talking and we had a long discussion about, raising the minimum wage. Of course, I am for raising the minimum wage. And as a business owner, he was not sure that we needed to raise the minimum wage to what I suggested as a minimum is $15. And so this conversation, we talked about, what it costs to live. And so when we're talking about homelessness, I mean, at the current minimum wage, it's just impossible to live off of the current minimum wage. And so we got, after talking about 30 minutes, he said, well, what's the minimum wage in Delaware? And he said, the minimum wage is over $9. I said, no, it's not. It's not over $9. So we both whipped out our phones and looked it up. And sure enough, it's $8.75. And he said, oh God, that's awful. So, and that really is the case. You cannot, you just can't live off of that minimum wage. Yeah, I mean, to pay rent or mortgage or to do health care, child care, before and after care, all the things that you have to do, families have to do, is just unreasonable to expect that people will be able to live sufficiently off of $8.75 minimum wage. So I am for raising the minimum wage.
Thanks, Debbie. Next is, let's see, Kyle Evans-Gay, Democrat of Senate District 5. Kyle.
Thank you. I will say that I do think Marie raised her hand first, so I'm happy to yield to her. Okay, thank you so much. I'll echo Debbie's sentiments and just kind of talk about, what I love to hear our Representative Lisa Blunt-Rochester talk about, which is proximity to the issues. And if elected, I would be the only mother of young children in our state Senate. And I know what it means to want to live with my family in a safe community and the cost of that. And I understand what it means to send my kids to quality childcare, and both my children at school age, and the cost of that, and the cost of babysitting and all the different things, so that my family can be safe and healthy, and so that I can pursue my economic destination, and be a contributor to our economy. And so, when I think about what we need to do with the minimum wage and increasing the minimum wage, I really do think about families and my counterparts who don't have the same job I happen to have that does pay me over the minimum wage, and that I'm doing an honest day's work, and so are so many other Delawareans. We need to start to bring that equity closer together and make sure that as a society and as a state, we are supporting our workers in many ways, not just with the minimum wage, but understanding how we can make childcare more affordable, and how we can have programs like paid family leave that will enable folks in any type of profession or trade to kind of live their life not on the edge, but supported by their community.
Thanks much. And Marie, I think we'll have the last word. I don't see anybody else. Marie Pinckney, Democrat, Senate District 13. Marie.
Thank you. Another great question. I don't want to rehash all of the wonderful points that most of my soon-to-be colleagues have already made. I absolutely am in support of a $15 minimum wage and tying it to inflation index so that we don't have to continue to fight this same battle in a few more years. One other point that I want to kind of make also is that it's not just the minimum wage that we need to worry about, it's also the youth and training wage. We have adolescents who are working working jobs to help support their families. We have people who are getting new jobs to help support their families. And simply because of having one of those two factors, being an adolescent or being in training at a new job, they're able to be paid 75 cents an hour less than minimum wage, just because they're an adolescent or just because they're new to a job. So these are things that we need to keep in mind as well, so that we're making sure that we're providing equity all across the board. So absolutely, we need to raise minimum wage, and we also need to get rid of the youth and training wage that is also systemically holding back people as well.
Terrific, Marie. Thanks so much. Appreciate your time and everybody's time tonight. Kind of is going to bring us to the end because we won't have time to get another question in to give everybody their fair time. And I don't want to take any time from anybody. So again, thank you so much to all the candidates for being here. I've really enjoyed the conversation. I think it's been obviously a really important topic, but I think it's been an important conversation. And thanks to our lived experience guests as well. We appreciate you sharing your experience with us and being willing to be so open about the details of your life that can maybe help other people who are going through the same things that you've gone through. And to the voters tonight, thank you so much for joining us. We appreciate it, and don't forget to get out and vote on Election Day. Here with some final words is Chair of the Delaware Continuum of Care, Carrie Casey. Carrie.
Great. Thank you and good evening. Mark, thank you so much. I'm Carrie Casey. I'm the chair of the Delaware Continuum of Care. And I really just have to reiterate the thanks to you all for taking time out of your busy schedules to be with us. When we started to plan this, we have a planning committee. We've met weekly for about 2 months. And when the first person, I think it might have been Eric Morrison, or he RSVP'd, and Kyle, we were so excited because we like that made it real for us that we were actually going to do this, because we really truly believe that homelessness and housing is a human right, but we believe that homelessness before COVID was a major issue. And now with this pandemic and the challenges of not being able to shelter in place if you don't have housing, we really felt that it was our duty and mission to bring together some of our candidates. And I just can't say thanks enough. To the lived experience guests, they are our VIPs. They are the people that really bring it to to why we are here. And to Mark, just to have you as our moderator again, I just can't begin to say thanks enough for your time and helping us bring attention to this issue. And just a little thanks again to the planning committee that's been working diligently, Deborah and Terry and Tyler, and I know I'm missing somebody here, but the folks at Housing Alliance Delaware that support the activities of the Continuum of Care. Rachel, Stucker, Alexa, and Aaron. Aaron was our timekeeper. So, you heard her. She was like 30 seconds. She was ready to mute people, but she didn't even have to because you all followed the rules. So thank you a million times over. I just don't want this to be the end of the conversation. And I just want to invite you all. We have a membership of 90 to 100 members statewide. We meet quarterly. And as of March, we've begun meeting on Zoom, which has actually been pretty good. Our annual meeting is next week, but we would, if it's okay, we'd like to add you to our mailing list and our email list, because we really have, our mission is to end homelessness in the state. And to have you all taking the time and hearing such wonderful things that, your real commitment to that, we don't want this conversation to end. And we hope that you will consider once you're elected and you've got your feet on the ground, coming and being part of our CoC membership. So I just want to put a plug in for that, because we don't want this to end. We want to keep you all in with us as we work together to end homelessness. And so really that's it. I just wanted to say thanks. Big issue.
Can I say, Carrie, it's awesome having you as a constituent. Your work is amazing. And because of you, I'm so proud to serve as your state rep because of the wonderful.
Well, thank you. Thank you very much. So thanks again. And I think that's really all we have for this evening. We're getting out 5 minutes early. So Hope that's okay.
Hey, Carrie, can I just say one thing to Terry? I didn't catch her before. I don't know if she left or not, but Terry, I just wanted to thank her for her service to veterans. She talked about, I think Mark explained that she works a great deal with veterans, and veterans homelessness is something that I'm terribly concerned about. As a veteran myself, I hope that to be one of those soon who will be working on veterans issues. And so I just wanted to thank her for her service to our veterans.
You're welcome. And I'm a veteran myself.
Oh, very good. That's even better. That's even better. Thank you, Tara. That is excellent. And keep hanging there. Keep doing it. Yeah.
Yes, ma'am.
So thanks,
Yeah.
everyone.
Thank
Have
you
a
guys.
great
Thank you for your
evening.
hard work.
Yeah,
Take
don't
care.
forget. Thank
Good night,
you.
everyone.
Thanks, everybody.
Good night.
Have a good night.